Ethiopia, a country in Africa, has a rich history and diverse culture. Farming is super important to its economy. It's not just about growing food to eat, it's about keeping the economy strong and helping millions of people live better lives. Most Ethiopians work in farming, and it's a big part of the country's wealth. Ethiopia's fertile land has fed people for generations. To understand how Ethiopia is growing and changing, we need to understand how important farming is. It has the power to make the economy stronger and make life better for everyone. This video will look closely at farming and healthcare in Ethiopia, talking about the problems, celebrating the good things, and showing how they're connected. Ethiopia's farms are as diverse as its land, from the high mountains where coffee grows to the low plains where animals graze. Coffee, sometimes called black gold, is one of Ethiopia's most valuable exports. People all over the world love its smell, and growing it helps many farmers earn a living. Besides coffee, grains like teff, wheat, corn, sorghum, and barley are what most Ethiopians eat every day. These grains are important so everyone has enough to eat. Growing beans, oilseeds, fruits and vegetables adds variety to people's diets and creates more jobs. Ethiopia also has many farm animals like cows, sheep, goats and camels. These animals are important for many people, especially in the countryside. They provide meat and milk and are also valuable things families can sell if they need money. Even though farming is so important, Ethiopian farmers face big problems. Because they mostly rely on rain, farms suffer when the weather changes, especially when there are droughts. Climate change makes this worse because the rain is unpredictable and crops might fail. Another big problem is that farmers don't have access to modern tools and equipment. Many farmers don't have good seeds, fertilizer, or ways to water their crops, so they can't grow as much food. Bad roads and transportation make it hard for farmers to get their crops to markets to sell. Problems with the land, like losing forests and not using land well, make things even harder. The Ethiopian government knows how important farming is, so it has started programs to help it grow stronger. The Agricultural Growth Program (AGP) and the Sustainable Land Management Program (SLMP) are good examples. The AGP helps farmers grow more food by using better seeds, taking better care of their animals, and getting water to their crops. The SLMP helps protect the land so farmers can use it for a long time. The government is also building better roads, irrigation systems, and places to store crops. This makes it easier for farmers to sell their crops so less food goes to waste. Ethiopia has also made great progress in healthcare. The country has a system with 3 levels, and the most basic level is most important. This level includes small health posts, health centers, and bigger hospitals in each district. This ensures that everyone, even people in far-off places, can get basic healthcare. One great thing is that more hospitals and health centers have been built, especially in the countryside. This has helped more people get the healthcare they need. These improvements have made a real difference. Fewer mothers and babies die, and more children are getting important vaccines. The Health Extension Program, a program that goes right to people's homes, has been really important in helping people get healthcare and learn how to stay healthy. Even with this progress, Ethiopia's healthcare still has problems. There isn't enough money, which makes it hard to build new hospitals, buy medicine, and train more healthcare workers. The small amount of money spent on each person's healthcare shows how little money there is. Another problem is that there aren't enough doctors, nurses, and midwives, especially in the countryside. This makes it hard to give everyone good healthcare. Ethiopia needs to train more healthcare workers. Also, many people in Ethiopia are sick with diseases like malaria, tuberculosis, diabetes, and high blood pressure. Many children don't get enough healthy food to eat, which shows how health and food are connected. Farming and health in Ethiopia are very closely connected. Good farms mean everyone has enough healthy food to eat, which helps people stay healthy. And healthy people can work on the farms, which helps grow more food. When people don't get enough healthy food, they can get sick more easily. But when people are healthy, they can work hard on the farms and grow more food for everyone. How farmers grow food can also affect people's health. Using too many pesticides can make the water and food unsafe. It's important for farmers to farm in a way that's good for both people and the environment. To build a better future, Ethiopia needs more help with farming and healthcare. This isn't just about money, it's about helping people and communities grow stronger. Groups around the world, governments, and even regular people can help Ethiopia. Giving money, sharing knowledge, and training people can make a big difference. It's important to help farmers learn new things, farm in ways that are good for the environment, and sell their crops more easily. It's also important to give more money to healthcare, train more healthcare workers, and help people stay healthy. Ethiopia has a lot of potential, but it also faces big challenges. By focusing on farming and healthcare, trying new ideas, and working in ways that are good for the environment, Ethiopia can build a great future for its people. Imagine a future where farmers have what they need to be successful, where everyone can get healthcare, where children grow up healthy, and where the country is strong because of its farms and healthy people. This is a future worth working for, a future we can build together by working hard and sharing the same dream of a healthier and more successful Ethiopia.